What is the preferred site for routine venipuncture in adults? A. Brachial artery. B. Basilic vein. C. Median cubital vein. D. Dorsal hand vein. Answer: C. The median cubital vein is centrally located, easily accessible, and has the lowest risk of complications. What is the maximum recommended time a tourniquet should remain on a patient's arm? A. 30 seconds. B. 1 minute. C. 2 minutes. D. 5 minutes. Answer: B. Leaving a tourniquet on for more than 1 minute can cause hemoconcentration and affect lab results. Why should the basilic vein be avoided if possible? A. It is too deep. B. It has no blood flow. C. It lies close to arteries and major nerves. D. It is too superficial. Answer: C. The basilic vein runs near the brachial artery and median nerve, increasing the risk of complications. When is it appropriate to use the hand or wrist veins for venipuncture? A. If the median cubital vein is bruised or inaccessible. B. On every patient. C. When drawing blood cultures only. D. Never. Answer: A. Hand or wrist veins are acceptable alternatives when antecubital veins are not usable. What is the proper angle of insertion for a venipuncture using a straight needle? A. 15 to 30 degrees. B. 45 to 60 degrees. C. 5 to 10 degrees. D. 90 degrees. Answer: A. A 15 to 30 degree angle allows the needle to enter the vein smoothly without going through it. Which action is incorrect during a venipuncture procedure? A. Releasing the tourniquet before removing the needle. B. Labeling tubes after leaving the patient. C. Asking the patient to clench their fist. D. Using gloves. Answer: B. Tubes should be labeled in front of the patient to ensure proper identification. What should a phlebotomist do if blood stops flowing during a draw? A. Immediately remove the needle. B. Ask the patient to drink water. C. Adjust needle position slightly. D. Start with a new vein. Answer: C. Minor adjustments may reposition the needle into the vein and restore flow. What is the first tube typically collected in a venipuncture draw? A. EDTA. B. Red top. C. Blood culture. D. Sodium citrate. Answer: C. Blood cultures are collected first to avoid contamination from additives in other tubes. Which of the following is not a complication of venipuncture? A. Hematoma. B. Syncope. C. Hemoconcentration. D. Hyperglycemia. Answer: D. Hyperglycemia is a metabolic condition unrelated to venipuncture technique. When using a butterfly needle, which tube should be filled first? A. Red top. B. Coagulation tube. C. EDTA. D. Gray top. Answer: B. A discard tube is used first with a butterfly when drawing coagulation tests to prevent underfilling. What is the primary reason to avoid probing for a vein with the needle? A. It causes vein collapse. B. It increases the risk of nerve injury. C. It reduces clotting. D. It prevents contamination. Answer: B. Probing can damage nearby nerves and tissues, causing pain and complications. What should be done immediately after needle withdrawal? A. Apply ice. B. Instruct the patient to stand. C. Apply pressure with gauze. D. Shake the tubes. Answer: C. Applying pressure helps stop bleeding and prevents hematoma formation. A collapsed vein is most likely to occur when A. The patient is dehydrated. B. The needle is too large. C. A tourniquet is not used. D. Tubes are underfilled. Answer A. Dehydration can reduce vein turgor, increasing the risk of collapse under vacuum pressure. What gauge needle is most commonly used for routine venipuncture? A. 16. B. 18. C. 21. D. 25. Answer C. A 21 gauge needle is the standard size for general venipuncture in adults. If the phlebotomist accidentally punctures an artery, what should they do? A. Continue collecting. B. Apply firm pressure and seek help. C. Bandage lightly and ignore. D. Switch to the other arm. Answer B. Arterial puncture requires immediate attention due to the risk of severe bleeding. The bevel of the needle should face _ during insertion. A. Down. B. Either direction. C. Sideways. D. Up. Answer D. Bevel up insertion allows smoother entry into the vein. Why should patients not pump their fist excessively? A. It increases blood flow. B. It may cause hemoconcentration. C. It prevents bruising. D. It helps clotting. Answer B. Excessive fist pumping can concentrate cells and skew test results. What is the proper way to mix additive tubes? A. Shake vigorously. B. Invert gently 5 to 10 times. C. Spin in a centrifuge. D. Leave upright. Answer B. Gentle inversion ensures proper mixing without hemolysis. Which vein should be prioritized if both are accessible? A. Basilic. B. Cephalic. C. Median cubital. D. Dorsal hand. Answer C. The median cubital vein is preferred due to its size and stability. How should a needle be disposed of after use? A. Recap and discard in regular trash. B. Leave on the tray. C. Place uncapped into sharps container. D. Wash and reuse. Answer C. Used needles should never be recapped and must go directly into sharps containers. What is the next step after inserting the needle and seeing a flash of blood? A. Withdraw the needle. B. Remove the tourniquet. C. Push the tube onto the hub. D. Apply gauze. Answer C. Once blood is seen, tubes are inserted to begin collection. What is the most likely cause of hemolysis during collection? A. Using too small a needle. B. Patient anxiety. C. Long fasting. D. Tourniquet removal. Answer A. Small gauge needles can rupture red cells, causing hemolysis. When performing venipuncture, what step comes immediately after identifying the vein? A. Apply bandage. B. Insert the needle. C. Clean the site with antiseptic. D. Label the tube. Answer C. Cleansing the site reduces infection risk before puncture. What action is inappropriate when a hematoma forms during the draw? A. Stop the draw. B. Apply pressure. C. Lower the arm. D. Elevate the arm. Answer C. Lowering the arm increases blood flow and worsens bleeding. How long should pressure be applied after venipuncture? A. 10 seconds. B. 30 seconds. C. 1 to 2 minutes. D. Until blood collection begins. Answer: C. Pressure should be applied until bleeding has stopped, typically 1 to 2 minutes. What should be done if a patient feels faint during the draw? A. Continue quickly. B. Remove needle and lay patient down. C. Ignore and keep drawing. D. Give them sugar. Answer: B. Safety is priority. Remove the needle and prevent injury from falling. What should the phlebotomist do if the site becomes swollen during blood draw? A. Keep drawing. B. Adjust the tourniquet. C. Stop the draw and apply pressure. D. Push the tube harder. Answer: C. Swelling indicates infiltration or hematoma. Stop immediately. What indicates successful vein entry during venipuncture? A. Patient pain. B. Immediate swelling. C. Flashback of blood. D. Bruising. Answer: C. A flash of blood confirms that the needle is in the vein. What is the main purpose of anchoring the vein? A. Increase pain. B. Prevent vein rolling. C. Delay clotting. D. Save time. Answer: B. Anchoring stabilizes the vein and prevents movement during puncture. What is the best approach if a vein cannot be located? A. Use the foot vein. B. Blindly insert. C. Apply a warm compress. D. Insert needle into muscle. Answer: C. Warmth helps dilate veins and improve visibility. Which complication is more likely when using the basilic vein? A. Infection. B. Arterial puncture. C. Hemolysis. D. Bruising. Answer: B. The basilic vein lies close to the brachial artery and nerve. During blood collection, the tube fills slowly. What might be the cause? A. Bevel against vein wall. B. Too large needle. C. Tourniquet too tight. D. Patient moved. Answer: A. The bevel against the vein wall can restrict blood flow. What is the last step in the venipuncture procedure? A. Apply tourniquet. B. Insert needle. C. Label specimen. D. Check ID. Answer: C. Specimens must be labeled immediately after collection. If a needle is inserted too shallow, what can happen? A. Hematoma. B. Missed vein. C. Hemolysis. D. Infection. Answer: B. A shallow angle may result in the needle not reaching the vein. What does palpating a vein mean? A. Injecting saline. B. Tapping to locate. C. Feeling the vein with fingers. D. Warming the site. Answer: C. Palpation is the act of feeling for the vein's location and bounce. Which vein is located on the thumb side of the arm? A. Basilic. B. Cephalic. C. Median. D. Femoral. Answer: B. The cephalic vein is located laterally on the thumb side. Which of the following may increase risk of hematoma? A. Immediate pressure. B. Prolonged tourniquet. C. Failure to anchor. D. Excessive mixing. Answer: C. Unanchored veins can move during puncture, increasing the risk of hematoma. Which patient position is safest for faint-prone individuals? A. Standing. B. Reclined. C. Walking. D. Leaning. Answer B. Reclining helps prevent falls and injuries if syncope occurs. A tourniquet should be placed how many inches above the puncture site? A. 1 to 2 inches. B. 3 to 4 inches. C. 5 to 6 inches. D. Directly on site. Answer B. 3 to 4 inches above allows proper vein engorgement. What happens if tubes are filled in the wrong order of draw? A. Faster results. B. Better mixing. C. Cross-contamination. D. Hemostasis. Answer C. Additives may contaminate subsequent tubes, affecting results.